Actually, a GP is really important as part of your ongoing care. The GP can actually be the key, if you like, to pointing in the right direction for many different services that you may require as you manage your disease. So there are ways of doing this. So there are care plan managements that you can organise with your GP, which are really important. They can also organise things, people like dietitians and occupational therapists, psychologists, physiotherapists, all of which can be really important in your ongoing management. And they can be the middle person to coordinate all of this for you.
So the healthcare team definitely would not be there without the patients. So the patient's the primary in that healthcare team. Then there's the rheumatologist, there's the general practitioner, there's the physiotherapist who helps them especially with their physical therapy, which is vitally important. The exercise physiologist also helpful with their posturing perhaps and the way they do things. The occupational therapist is a home assessment, making sure that their home is a safe and functional place for them to be. A dietitian to help them with their weight management and sound nutrition, which is very important. And especially with psoriatic arthritis, a dermatologist, perhaps even with ankylosing spondylitis, an ophthalmologist. But the simpler, the better. And the team will change over time. So depending on the patient's needs, the team may increase in size or become more simplified with time.
Your team is going to evolve and it's going to change through your arthritis journey. So when you're first diagnosed, the most important people may be just your rheumatologist and your GP to get the disease under control. But over time, as you learn to live with your arthritis and as your illness becomes more stable, you might then incorporate other people into your team that can help you at different stages of the process.
The team that I have assisting me with my AS has changed over the journey. Early on, as I said, it was my physio, a doctor for referrals and my rheumatologist for diagnosis and monitoring. It changed. At different points I've seen different people. Since I was diagnosed, it's really only been a physio and my rheumatologist, and actually more recent times I actually haven't seen the physio at all. I haven't probably been once in the last 3 years. The journey for me has been about different people at different times and different needs. As you move from like pre-diagnosis to diagnosis and beyond, your needs will shift and every person's different. Some people, I've seen a nutritionist at one point in time just to get on the right path with my eating.